Hello and welcome. We welcome you today to our special Board of Social Services meeting. Today is Wednesday, February 11th, 2026, and we're here this afternoon in the Commissioners' Conference Room for the Board of County Commissioners at our Administrative Services Building. I am Larimer County Commissioner Chair Jody Shattuck McNally. I'm joined by my colleagues Commissioner Gonzalez and Commissioner Kristen Stevens. Also joining us is our County Manager Lorenda Volker and our Assistant County Manager Lori Cadridge. And I wanted to just say we are convening today as the Board of Social Services and make sure we emphasize that. So now I'm going to just turn this meeting over to Heather O'Hare, our Human Services Director. And there's lots of important people, amazing people at the table, but I'm going to allow Heather to introduce her amazing team. And welcome and thank you all.
Thank you, Commissioner. Heather O'Hare, Human Services Director. I am going to have my team do quick introductions just so that as we get going on the presentation, we can keep it more of a dialogue. So I'll have Thad start.
Thad Paul, Division Manager for Child, Youth, and Family Division.
I'm Jill Mosh, Division Manager for Operations and Organizational Development.
Vanessa Fuel, Division Manager for Benefits and Community Support Division.
Kayleen Rowley, Business Operations Coordinator.
Okay, thank you. So we have 3 things on the agenda. I did want to add a fourth at the very end, just to give you an update on the state proposals to centralize some of the shared services and the districting proposal, just so you know where that is at. But any other agenda items that you all wanted to add before we get started?
Colleagues, are there any agenda items you wish to add? Nope. But thank you for asking.
Okay, so I'm going to turn it over to Vanessa to walk you through a new partnership with UC Health that is just getting going.
Thank you. Good afternoon. Once again, Vanessa Fuel, Division Manager with Benefits and Community Support. And I'm going to share some exciting relationship changes that we have with our partners with UC Health. This partnership is to increase access to Medicaid benefits, specifically Medicaid, but we also intend to incorporate our food assistance program and any other wraparound services that we can provide to UC Health patients. We had a rule change happen this year, in 2025, where Healthcare Policy and Financing has said that counties need to have formal structured relationships with medical providers. So it's our goal to streamline and make sure that we have timely enrollment to Medicaid programs because it's a healthcare policy and financing rule. That's why there is the emphasis on Medicaid. But again, out of recognizing that people have multifaceted needs, we want to make sure that we're meeting those needs with our staff member that we provide to this partnership. So we have a dedicated community support specialist who will be assigned on site at Poudre Valley Hospital and the Medical Center of the Rockies. The specialist will handle all those combo case applications, including Medicaid, which also includes our long-term care program. In the eligibility world, long-term care is treated as a separate program that requires additional training. As I mentioned, SNAP or food assistance and our other cash programs. So our community support specialists can process, approximately 126 applications per month. And the current demand for UC Health is 115 applications per month. Because applications aren't necessarily the only work that might be there, that means that there's a little bit of additional capacity for that partnership with the specialist on site. They may also have a patient on site that is currently a Medicaid client or currently has the food assistance program, but needs to work on their redetermination. So with the additional potential time that is available to this staff member, they'll use that time to support the patients in other ways. So we will provide their laptop. They can take their laptop, they can dock right in, but they'll be able to have full access to the systems that they need to do their work. We will also provide the supervision and the training for the employee. So they will maintain their position on a team within the Benefits and Community Support Division. So let's talk a little bit about funding. We went back and forth, excuse me, with our UC Health partners, because there's a couple of different ways, as you all are familiar with our funding structures. Depending on which programs are included, we have a higher or lower match. So because UC Health wanted us to support the whole person and not just do Medicaid assistance applications and work, we need to use our county administration funding. Our county administration funding is made up of 50% federal, 30% state, and then there's a 20% local match. UC Health will be responsible for that 20% match. So we are not paying that with our local dollars for this staff member to serve them. That's part of the mutually beneficial agreement that they're then going to have that Medicaid payer for that patient. There's an enormous benefit to them as a hospital system to have that payer source. So once the formal agreements are complete, and we're pretty darn close to having those signed, we just got the final word from their team this morning that they are good with all of the changes. So now we're just moving through the formality of getting that contract officially signed so that we can start having our person on site. Our staff will manage the ongoing maintenance and relationship. Jill's team has been fabulous to help usher this contract through the process and make sure that it's meeting all of our legal requirements as well as all of UC Health's legal requirements. Some of the outcomes that we brainstormed throughout this process, what do we want to track and what do we want to know about the work that they're doing? One of the things we want to know is how much volume of work. Is the volume kind of maintaining as it has been? Does it go up or down? Does it depend on, where we are in the month? If for some reason, excuse me, sorry, I'm getting over this respiratory thing. If for some reason there is a higher volume of applications, we have our teams that can serve as backup. And I think what I want to clarify here is we already do this work today. It's just a different process for how it gets to us. And it's a more direct line from UC Health to us. They don't then go into our regular process and system. We have a person dedicated to catch their work in particular. That's the change. But today they are having people apply and that work comes into us. We process all of their work now. It just may take a little longer because they're in the queue waiting to be worked along with the other applications that are there. So with that, then we want to know, are we reducing the number of days from the time of application to the time they are eligible? And this is something that UC Health tracks on their end today. They want to know when they're going to be able to get paid for the services that they are currently providing, right? These are patients in their hospital, often in an inpatient unit that doesn't have a payer. So for them, they are watching very closely from the time we apply for Medicaid to the time we receive that eligibility determination. We want to reduce those number of days. The success will be validated by the execution of formal agreements and a reduction in application processing time. That is how we are measuring success, fewer days from time of application to time of eligibility determination. And then we will also serve as an opportunity to refer or work closely with the hospital's social workers for discharge planning. This initiative lays the foundation for sustainable cross-sector partnerships, and it improves health coverage access for underserved populations. We really do have a commitment to working with our community partners of all varieties, not just in the health sector, but this one in particular, because they are able to come to the table with that match, maximizes our ability then to support them in ways that we can't always do with every other partner that doesn't have the ability to put some money into the process to create that direct line from the clients that they may be serving or patients or whomever to our teams. So we're pretty excited. And it's been a really wonderful process to work with UC Health and really forge these relationships with them. I was able to go on site and do a site visit, see the locations where our staff member will be sitting, and we've recruited someone for that work. So she'll start as soon as we get this contract executed, and with that, I'll open it to any questions or comments, or if Heather has anything to add.
I'll just add two, I think, really key points. So this is an existing FTE. We've selected an existing staff member for this role because the work is already coming in. The work is already part of our volume that we have. We want to just separate it out and treat it a little bit more specialized and do that work on site. So that's the first piece. We've also had conversations with UC Health that we may want to expand this. We may show that this one person can't handle that volume if we are intentionally increasing the volume through this partnership. So that's why the metrics that Vanessa mentioned on our side, but also on the UC Health side, is really crucial. And we've had those conversations. They're very open to increasing potentially their fiscal contribution to be able to increase the staff. So it's not a new position. It is an existing staff member who has fantastic skill set, bilingual, brings a lot of, I think, really important cultural pieces and skill set too to the work. And she will split time between PVH and MCR during the week. And it really is one of our, I would say, very first co-location examples. We've been talking about this strategy, I think, for almost 5 years now. And I know HCPF is very excited because we are the first county to get this off the ground since the rule passed, I think, in May. And it was honestly very simple to get it. We started these conversations with UC Health, I think, in early November. And we're able to actually add all of the CDHS programs, the Department of Human Services programs, into the mix. And that also is new and not what HCPF intended, but they are excited to see that we're doing this from a much more person-centered, holistic approach to be able to help people either transition out of the hospital or get to that next place by being able to access Medicaid and other benefits.
Thank you, Heather, for that additional information. Commissioner Kafalis, I see that your hand is raised.
Yes, thank you, Madam Chair. Thank you for the presentation, Vanessa. This is great news. Anytime we can hear great news, makes us all happy. And also, you suggested that this was a simple process, and I didn't think that anything could be simple anymore. So thank you for that. I do have two questions, if I may. One is, since this community support specialist 2 will be stationed at both PVH and MCR, how will it be determined how much time at both facilities? And then I have a second question.
Yeah, thank you for the question. So in our conversations with UC Health, they were able to break down which hospitals have the highest volume. So PVH has the highest volume. The staff member will be stationed there Monday, Wednesday, Friday, and then they'll be at MCR on Thursdays. Tuesdays is Benefits and Community Support Division's in-office day. So the staff member will come and still be in office with us to get those training, the supervision, the connection with the team, staying connected to our organization, and making sure that they're up to date and current on all of the, we know these programs are changing all the time. So there's a lot of training pieces that come into play. And they will also attend our monthly eligibility large team meetings where we have additional trainings. Those happen one Thursday a month.
Thank you. May I ask my second? Yes. I understood from your presentation that the community support specialist 2 would be focused entirely or primarily on helping people navigate Medicaid eligibility and SNAP. Will they be able to help people navigate other support services that they might be eligible for? For example, if they're not eligible for Medicaid, could they point them in the direction of, well, hospitals usually have various discount programs for, healthcare costs, or maybe they're eligible for A&D or SSI. Will they be able to help in those instances, or would that be more tighter would that be a more tighter collaboration with the social worker, the hospital person over there?
Yeah, thank you for that question as well. So one of the benefits of having them on site is that they'll be embedded with the hospital's financial counselors. whose role it also is to find those alternative financial assistance. Any program that we are responsible for, though, so A&D, for example, our staff member will process that work. But if it's outside of the scope of what we do in our division, then it will be that collaboration. So either as part of working with the social work team or those financial counselors. But that's the benefit of sitting right in the same space as them every day. Then they're going to be able to figure out how to pass that baton from one to the other if they need to do that. And it was kind of neat. I got to see how if you have someone from the public coming in, they have these sliding glass doors from sort of the cubes of where those financial counselors sit. So if someone needed something, they could just pop back in and grab someone else to come out and meet with that individual. If they're on the floor in an inpatient setting, then they'll work directly with the social work team.
No, thank you very much, Shai. And thanks for reminding us about the financial counselors, because I know they have an important role there. Thank you, Madam Chair.
Thank you, Commissioner Gonzalez. Commissioner Stevens.
Thank you. I think this is a really great idea. I think this is a really great program. It obviously benefits the hospital. They have more predictability on when they might get paid. One of the things with some of the new, work requirements, other requirements for Medicaid, and, how easy is it to do all of this in a hospital setting? Like, I mean, do people have to bring back documents and show, does that sort of it certainly must complicate things a little bit to have some of the new requirements. So is this sort of a can they work with as many clients knowing that there's a lot of eligibility requirements at this point now? I mean, can you just speak to that just a little bit? Yeah.
Yeah, thanks for the question, because we're definitely kind of keeping an eye on what is to come with the changes to Medicaid that haven't hit yet. So some of that isn't here yet, but it's coming. To your question about verifications, right? When we have something that happens in SNAP, for example, and we need to find out, do you have any employment? There's a lot of verifications that we can do through interfaces on the back end. So we don't need like physical paper to do that. It's also kind of amazing how much stuff you can get on your phone. So if we need any other records, they could pull that up on their phone while they're there. If they have a family member that we might be working with to help get whatever those verification items may be, there's a lot that we're able to do without ever having to get physical papers. But if there were that need, then it would go, what happens now is that case gets pended in our system until we have all those verifications. So that case would be pended, and then likely the follow-up will be happening in a sort of coordinated manner with the UC Health partnership as well, with those teams that are supporting patients.
I would add also that so Vanessa highlighted the applications per month that we're starting with as the baseline. So with 115 applications, but capacity for 126. That capacity will also be prioritized for that as well. They will work on the follow-up for those verifications and the documents within that capacity, with the overall goal being to make sure if this person is eligible that they're getting the resources quicker. And so being strategic in that capacity too is also part of that process, so that they're staying focused on those applications because they're able to, we're pulling them out of the larger bulk of work that right now just comes into the office regardless of where it comes in from. And so this will also help us figure out how we pilot some of that, how we learn those business processes that we need to change. The other piece I would add is that our conversations with UC Health first started in wanting to have a regional approach with Boulder, Larimer, and Weld. And we convened those conversations with the three counties and The three counties were just in different places in being ready to move this partnership forward, and the bulk of the work are for Larimer County residents, even though there are Boulder County residents coming into Medical Center of the Rockies and into other UC health facilities, and also Weld County residents coming in. So we are also working towards a regional partnership to be able to really meet the needs of whoever might come into the door of Medical Center of the Rockies, regardless of whether they're a Boulder resident or a Larimer resident, but the logistics of that were not there yet. And so we didn't want to delay this partnership, one, because the majority of the work is ours. And we can learn a lot from the initial processes to then be able to expand that to also meet the needs of someone who might come in from Estes Park or, another area of Larimer County alone, that will very quickly learn how to tweak this to then be able to broaden it even further.
Great. Well, I think I'll be really interested to hear how it goes, but I think it's, beneficial, obviously, for the patients, for the hospital, for us. I'm glad you've identified somebody who's kind of already doing this work and has that skill set to be able to work. But I do like the idea that we're, sort of embedding people in other organizations where they can help, and the idea that they can maybe help with more than just Medicaid, but really maybe some of the other services that we provide. We know that not all the people that qualify get SNAP benefits, and so, just another angle there for helping people in our community. And maybe if they get the right nutritional food, they won't get as sick, and, all kinds of good things. So great partnership. Thanks for your work on it, and thanks for sort of piloting this for the rest of the state and showing how it can be done. Appreciate that.
Well, a lot has been said, and I echo that. I am super excited. It's great to be innovative and leading, but really what we're trying to do is what I call the Larimer way. We're just solving what works for us and meeting our constituents where they need us to be. And I really applaud the efforts there. And it's really great to hear that it was really simple, that it was kind of, I've had another situation where all the dots are right there in front of you, and all you have to do is push them together, and it works, right? And I think that sounds like this kind of worked that way. I appreciate UC's Health willingness to partner. But I know this is just the first step, and I'm sure you have ideas about other areas that might be easy to do. So that's one question I want to get back to. But the other question is, I know Thompson Valley Emergency Medical Services has some kind of program through their agency and their taxing district where they're trying to reach out and help folks that they run into that might need resources. And I don't know how they're doing that. They've talked about it a lot, and I've never had a chance to circle back and say, can you show me? But are we part of that? Are they connected to that? And then, well, first I'll ask that, and then I have that other question from the first part. Thank you.
So they are not directly connected to this in particular yet. We can take that back and look at it as we get this going to see. But we have had them come actually to the Human and Economic Health Directors team meeting several months back. And so they are very well connected to our adult protection team, as well as our Office on Aging, because that's a lot of where the resources are needed. And so it's that community relationship and that referral process that we have connected there. But there might be an even more intentional connection to this work too, that we just haven't looked at yet.
Yeah, and I think my brain's just spinning with here, and they're also in the community with being out talking, connecting to folks at fairs and festivals, and also that might be where they also can meet folks that might need. So just an idea. I know you guys are doing, it's just great work, amazingly. But back to my first question, you said you're already using an FTE. And if this is highly successful, and it was part of our, like you said, your kind of strategy to try to co-locate, which is something that I kind of asked a question a few years ago when we had visited Adams County, and they had some co-location of services, and it, I don't know, maybe I didn't ask the question right way, but it was kind of like, I don't know about it. But now we're here, and I just see it that we're kind of flipped it on its everyone coming and co-locating here, we're flipping it and going there, which I think is great. So if this is highly successful and this one person is doing this, what would it cost, or what kind of, if you needed to even add one or two, so that would be, because it's centrally located, which is great, near a kind of a really concentrated center. But if we need a more, I'm thinking about, always thinking about unincorporated parts of the county, if we needed to go to either end and have a more remote rural setting for something like that and co-locating somewhere, which I'm probably thinking of some projects that are already in the works going forward. What would that take? And would that be another expense for budget, or to be able to expand to meet that? Or would that just be something you would restructure within to be able to do that? Because it sounds like this might be something that if it works, we could rapidly implement other places just to be able to maybe have this kind of model. So I'm just curious about that as well. Is my question clear?
Yes.
Okay, thanks.
So it's both and. I have no doubt that this will work. We will learn from it and we'll need to tweak the approach for sure. But in my 30 years of social work, going to the person where they need it has always been more beneficial than just waiting for them to come to us, right? And so this is built on that philosophical approach. So us going to the areas of the community, either the population areas or the geographic areas where we're greater needed, is always going to be better than waiting for people to come to Loveland or Fort Collins. So we are building on that, but there is a lot of business process changes that we're working through to make that successful, which is why we're starting in small pockets. We have committed to the Wellington Community Center that we will replicate this there. In an even broader approach, right? Because that will tackle multiple programs. It is the challenge of how we do this within existing resources and pilot it and really determine the return on investment and the outcomes and the business process changes needed to then be able to see how we might expand it further. So I say it's both and, because we are doing this within existing resources, but this is also very similar to the outreach team that formerly was led by Deb DeLuca Forsley and the fantastic prevention work under Thad's leadership. That is why we moved them to be housed under Vanessa, is so that we are also thinking about prevention of crisis, right? Whatever that crisis is, child welfare or adult protection, prevention of the crisis really starts, unfortunately, with tackling poverty first and foremost. And so this is very aligned with what that team is also doing under Vanessa. It's just not housed in a hospital setting or one particular setting. It is branched out. And so determining the business process changes needed here, and then marrying that with the work that the outreach team does to go to fairs, right, and go to less brick and mortar locations, continues to allow us to move the needle forward within existing resources, while then we continue that conversation with you all to say, here's the success we're seeing and here are the challenges, and where we might need to address those challenges differently, whether that's resources or not. So we are still moving forward, even though we have a lot of resource constraints and a lot of change happening potentially from the state, because it's helping us get further prepared, right, for what the future might look like.
I appreciate your answer so much, and I'm not surprised that internally you've been making some changes to try to be able to pivot and be prepared, because you've been very active in a lot of circles to know what's on the horizon, and also what's immediately in front of you. And I want to thank you and commend you for that. My other thought on that, besides just the rural areas, but we also have partners like Sunrise Community Health Center. I don't know if we've reached out, because I know they have a lot of folks that might be the populations, vulnerable populations they co-house, and they might have some funding or support to help us put people there. I'm just curious, and I could also see connections to communities, because I think they've located some of their centers based on demographics and where they know some of, one of the reasons I was told they put that new Loveland Clinic in the north is because they knew of the population and the income and the need in that area, and so they wanted to place it near where the community need was. And so I'm also, that always was in the back of my mind, that might be at some time a future place to for us to partner anyway in the long run, because those are folks that might be in need of some of our services. So I just wanted to ask maybe a little bit about that, just to see if that has been conversations or thoughts there. Just curious about that too.
We have a very long list of community partners that have been saying, please come, we want to do this yesterday. Part of what I think is really important, though, to call out is that historically, there was a lot of resistance to actually allowing us to do this from HCPF. So that is one significant change in how we've historically administered the eligibility for Medicaid. The messaging from HCPF really has been, you can't commingle this too much because there's confidential HIPAA information, right? There's a lot of privacy information. They also have completely different federal regs. And so we needed that to change first. We needed there to just be a much better understanding between counties and healthcare policy and finance of how can we do this and still meet all of those requirements. So now that we have that, and now that we have this piece moving forward, I think we're going to learn a lot very quickly and be able to figure out what is that balance of how much do we co-locate, so that also we're not creating a team of staff that then become too disconnected from each other too, because that's a really crucial piece. The technical rules for these programs are only increasing, and so making sure that our teams are staying really well connected and see each other as a resource and still have that support, even though they may be in very different locations, is something else that we still have to work through.
And I think that is an excellent point to end on. I really appreciate you bringing that up, because I do think in a lot of ways, team support, and for a lot of reasons, even for just the stress of trying to help and the load, it'd be really important for them to be around others and peers and have that. So, because you guys have built an amazing program or embedded about peer support throughout your whole area, so I think that's a great point. So thank you for all of that. That just brainstorming, but also just I'm really excited about this and think it's just really what we need right now. So I appreciate that. Did you have Commissioner Kafalis?
Yes. Yes, thank you. Just two other questions popped up, and perhaps one could be a suggestion. And that is, if it looks like we will be serving folks in hospital and emergency care settings, let's say that someone is discharging from an emergency care setting due to acute crisis, mental health, behavioral health crisis, who will be responsible for the step-down process to make sure that they are being integrated into some kind of community mental health care?
So that would fall to the discharge planning team at the emergency room. So that is also part of what we've talked about with the UC Health team, is that our scope is still pretty limited. And we can be there to participate in those team meetings and to share the resources that we have. But in terms of the actual discharge planning and setting up all of those other services, unless it rises to the level of an adult protection need, our scope is still isolated from that, even though we may contribute to the conversation about the public benefit resources. So it's the hospital discharge social work team.
Thank you very much. Just my final question, suggestion, and that is, in terms of evaluation, you shared some of the metrics. I'm wondering, will that also include determining how many of these, how many people who we have helped in an emergency setting and people not in an emergency setting? And also, will we be looking at what monetary, public fund benefits there might be, because perhaps we're preventing repeat visits to the emergency department? So are those kinds of metrics going to be part of your calculations? How many folks are coming out of emergency or otherwise regular hospital? And then also, are we preventing folks from, if they get on Medicaid, then in theory they have a little bit more, a few more resources, and they might prevent them from going back into the emergency room, and we all know that typically saves money, and people are better for that. I hope that makes sense.
It does, and those are great suggestions. I'm taking notes, so we will add those metrics in. I mean, just as you were talking, thinking about how many Medicaid dollars as a result of this partnership end up in the health system would be great to know. Of the worker that we have on site, how many Medicaid dollars were brought into UC Health as a result of this partnership is not one that we had considered. So thank you for that. We'll add it.
And UC Health has a lot more insight into the data too, because they continue to be the treating provider in a lot of those instances, whereas the information we have is whether they come on Medicaid or not. So UC Health has shared all of the data. They have tremendous data, and I think we've just scratched the surface on those conversations, but
Thank you for considering. I just think it would be helpful in terms of evaluating the efficacy of what we're doing here, to have that kind of information. Thank you.
yes, yeah.
And I'll just add, if you're interested, there's another pilot study that has amazing data that is integrated mobile health care that took through the fire of advanced practice provider and a social worker in a fire vehicle going to frequent flyers who end up calling 911 and having the fire department in the ERs, and these were folks that maybe have had better care or services in home, like even fixing their walker that kept having them fall. There is some amazing data that's presented nationally and internationally that might also be helpful for you. If you're interested, I will ask those authors if they're willing to share, because I know they've been in a lot of talks with UC Health on this as well. So if you're interested in that, that also might have some interesting cost savings.
That would be great.
For the whole system, so we can
Yeah.
talk about that offline.
Yeah,
So,
that would be great.
okay, great. Any other further questions, any comments?
All right, so we are going to transition. We wanted to share another partnership update with you that is actually helping us to also think about and work through some of the logistics should the future for human services be to regionalize or create districts. So about 6 months ago, well, 2 years ago, really. I'll go back a little bit further. My counterpart in Grand and Jackson County, so they are regionalized. They are a district today. They don't have enough residents across the two counties, so they regionalize into one. And my counterpart, that is the director over Grand and Jackson County Departments of Human Services, reached out to me to say, can you help us with child care assistance program? We've lost a staff member, we're hiring, but we have this work sitting and these families and providers that need the support today. Can you just help us until we are able to hire someone and train them? We said, absolutely, sure, we would love to. So that was 2 years ago. And then, so they hired somebody, they got them trained, and within a couple of months, that person left Grand County with her family and moved elsewhere. And so they were back in this same situation. And my counterpart reached back out to say, we really appreciate the help, and this seems to be an ongoing hiring and retention issue that we're hearing a lot about from small and medium counties. They are not able to hire and then train the staff members. It takes 9 to 12 months to really train on just the basics of the eligibility rules before then that person is realizing they are not going to stay or they cannot stay in that community and they move elsewhere. So she came back to us about 6 months ago and said, we would love to start conversations for you all to just administer the programs for us. And what might that look like? So we've been continuing to help them with the workload while then working with our team, partnering with their team, and having David Aero from County Attorney help us on what this might look like. So Vanessa's gonna walk you through what this looks like. You will see the contract come, but the IGA, it is an intergovernmental agreement, come before you here in just the next couple of weeks. But wanted to share this partnership to show you a very real and today example of what the future might look like, and the success and opportunities that we've seen this provide to us, but also to Grand and Jackson counties. So Vanessa's going to walk us through it A bulk of the work also lives under Jill's leadership around the quality assurance and the program integrity, the fraud investigations when they come up, the provider contracts. So Jill will jump in to add pieces that she would like to add as well. Go ahead, Vanessa.
Thank you. So our regional collaboration with Grand and Jackson counties, Heather laid the foundation of this nicely. The partnership is where we, Larimer County, provide eligibility processing services for Grand County, which includes their regional agreement with Jackson County. We process new applications and ongoing recertifications. We conduct the quality assurance reviews on CCAP cases, do the fraud and fraud investigation and recovery on behalf of those counties. And in the future, we will take on the contracts for their provider contracts. With the Child Care Assistance Program, we have the direct contracts with providers as well as paying for the child care benefit. So there's a client component and a provider component. They've had a lot of longevity in their accounting team in Grand County, so they have been able to hold those tasks. Their accountant is soon to retire, and they said at that time, would you just also take on this component of the work as well? And we said, sure. So their caseloads are quite small. It's not a ton of work for our teams. Grand County has 21 cases and Jackson County has 1. So it's a small workload relative to our workload. Ooh, we have 650 right now, yeah. 650 children, so it's even fewer families, but by comparison to 21 cases. It's a drop in the bucket compared to our current caseload, but imagine the need of those 22 families and trying to access childcare in their rural mountain communities. So the real fundamental reason here is what Heather shared. Remote counties have persistent workforce challenges. We're able to provide stable expert solution for this really detailed program that is hard, takes a long time to learn. And then as soon as that person has a life change, then they're left without someone to do the work again. So one benefit is that we eliminate redundancy while supporting Grand and Jackson. Small caseloads make it inefficient for them to train and retain staff. Local communities still need the services. Those families still need access to childcare to be able to work. And the support of our team, I asked my team, like, tell me something good that happened. You know, what is something that a good positive interaction that you've had as a result of this partnership? And they shared that the support of our team enabled one family in Grand County to secure stable employment and move into their own home by providing access to childcare for their children. It's this very real, without access to, we just celebrated the 1B contract yesterday, that without access to childcare, people can't work. And when your childcare options are very limited in a mountainous community, it's even more difficult. So it is meaningful to the residents of the area, and it's meaningful to our staff to be able to be a part of that process for families. It assists Larimer County staff in maintaining proficiency. So we have been on a freeze for going on 3 years. 2 years. 2 years in February it was. It is February. So it's been 2 years now, which means that we don't go through the full process for applications. They're still supporting all of those families that are still on the program, so they continue to be able to see the life cycle of the case through redeterminations, but it keeps them proficient in the business processes around intake, the application side. So it is a benefit to our staff and our team to have this work. The workload is shared through all of our state systems, so similar to what we just talked about with Medicaid, we don't have to pass any paper. They're able to scan. We have shared Google Drive, Google folders that they can put the documentation in. So they still have a person in an office that accepts paper applications on site. So people can apply through Peak or they can apply via paper application. All of that still gets tied to their county of residence. and that the dollars that pay for their childcare come out of the allocations of their county of residence, but we're able to do all of that work, take care of the work for eligibility behind the scenes. And I think that was all I had on this. Yeah, that was it. But it's been a wonderful partnership, and, as we finalize the IGA to continue that partnership, it's mutually beneficial.
I had a just quick clarification. I don't see any hands raised, but when you talked about, we're doing the paperwork, that's administrative, and maybe you said this and I didn't catch it, but is their administrative costs or allocations smaller or different than ours? Does that all cross-connect and meet what we would need to pay for the capacity to do? I think this is great because we want to help our neighbors, and they are our neighbors. I've driven recently through Jackson and Route in Grand County and in the dark by myself, and there's really no one around, so I get it. But I'm just wondering what that looks like. Do they have different percentages and allocations, and do those match or close?
So they have very different allocations because the allocations are determined based on the caseload and the volume and the need. So they receive two different allocations for the two different counties. We have our allocation, but throughout this process, we set the rate, right? So our community support specialists that do CCAP, the average pay rate is this per hour, so that's part of the agreement. And then we look at the rates of cost for us for the quality assurance activity. So we look at all of the tasks and had that conversation to say, this is the cost for us for this rate to do this work for you. And are you in agreement? And then each month we share with them the time accounting of these are the hours we spent, and then they pay us from their allocation. So there's ongoing work that flows through Jill's team as she oversees accounting too, so that the work is, we are completing the tasks on our side, but they're paying for it based on our rate. So we haven't looked, because I didn't ask my peer what their cost of, we're having these conversations in the district meetings of what is a cost per case. So they might be paying a little bit more than they might to have a staff member, but the length of time to train somebody, the length of time to recruit, there's a lot of soft costs too that they're no longer able to maintain to keep somebody trained and on staff to do this. And so it is an equally beneficial relationship, and it hits their allocation, so they are paying for it out of theirs. So it is not part of our allocation. It is not impacting our freeze or wait list or our budget constraints, but it does allow us to keep our staff proficient, as Vanessa said, because they're still working through new applications and doing some of that we haven't had while we're on a freeze. So there's a training component too that's helpful for us.
And that's a great point I hadn't thought of before about keeping everyone fresh with the process. So thank you all. Does anyone else have any other questions? Commissioner Stevens and then Commissioner
Yeah,
Kafalas.
thanks, Madam Chair. So there's no remote worker in this kind of scenario. It's the paperwork is done through our office, and so that person never really even has to go into those counties. Is that right, or is there?
They might walk into the Grand County office to apply if they're not applying through the PEAK online portal, and then all of the work really happens remote on our end, with the exception of that staff member being in the office on Tuesdays. So from our perspective, the work looks exactly the same. It just happens to be someone who lives in Grand, and that staff member then tracks their time a little bit different so that we're charging it to the right place. But otherwise, the work actually looks the same.
And the tracking isn't any difficulty. You guys are used to tracking time
We
for different
yes.
reasons. Okay.
Just has a little
no, I-
earmark on it that looks different, but it's the same tracking.
Yeah, I love that this kind of gives us a little bit of a glimpse of what it would be like if hubs exist, and I think this is a great service. And one of the things that we found, Commissioner Shattuck McNally and I heard in a meeting yesterday was that we had heard, I think that it was Jackson County's like insurance has gone up so much, like 30% or more, and so I mean that could be a reason to not be able to retain people too, right? If those kind of costs go up, and so. They have a lot of challenges, I think, in small communities, and so this is really beneficial. And there again, some quality assurance and some good accounting practices that can, when you have a bigger staff, you can, have those kind of services available, whereas if you have one person doing everything,
Agreed.
it's tricky,
Yeah.
for sure, so.
And 22 cases is not a full-time staff member, so then trying to keep that person trained on all of the other work you want to fill their time with, I think adds to the challenge too.
Right, exactly. Well, thank you. Thanks for explaining this. I think it's a great partnership, and I'm sure they appreciate that we can help them with this.
Commissioner Gaffalis.
Thank you. I believe the last time I looked, the population of Jackson County compared to Larimer County is quite different. Well, I think they have about 3,500 folks there, and we have about 10 times as many folks here. My question, well, and this is great, very smart, innovative, thanks. My question is, and I hope it's not too much of a silly question, and that is, since we're being such good neighbors, if they are underspending with their child care allocation, would that provide incentive? If we need some help with any possible overspending, that this, unless it violates the formula, however we're doing that these days, is that a possibility or is that a crazy idea?
It is not a crazy idea, and they have sold to us in the past their allocate. So that's how this relationship came about. Was they sold to us even prior to us helping them with the work. So I think to Commissioner Shattuck McNally's point, it is the Larimer way, right? It's why we foster these relationships. Is further down the line, we have no idea what we might ask them for in return, and vice versa. So that is actually how this started. Was me reaching out to say, you're very underspent. Can we purchase some of your allocation to help us?
And I would offer that this is a very proper quid pro quo.
Well, and, I had heard last week, and I know Commissioner Stevens, I heard it again when the meeting I was with Commissioner Stevens about some of the Jackson County challenges where, they've lost a big, important public safety person recently. But knowing that their insurance costs have tripled, and just some of the things, I think, also just being good neighbors in the Larimer way, we think, we want to, look out for where we can and not be at an expense, but also it's important for us as well. I think Jackson's 1,300 people. Yeah, I think it's, in my head, one time it was like it was shrinking. So it's very tiny. So I think, and we do, it makes sense because we have the judicial district is 8, which is Jackson and Larimer. So I think there's a lot of overlap here. And so it just seems to make sense. So I applaud you for just finding, it's like I always say, you got to be ready for a door to open for innovation opportunities because you never know when the window's going to open and you got to go through it. So I appreciate you looking for all those open doors. So thanks.
So you will have the intergovernmental agreement come to you. We have drafted it to get us through June of 2027. So we're continuing this state fiscal year and then through the next state fiscal year, with the understanding, though, that we're open, as is Grand and Jackson, that it would continue on after that. But we thought 18 months is a good place to start, and then we'll revisit whether it still makes sense. Okay.
Let's keep going.
I'm going to transition. So every February, we always report out to you on where we are with our spending as of the end of the calendar year. So halfway through the state fiscal year. So I will walk through that. The division managers are going to jump in with some additional context, particularly around child welfare. Just to update you all on strategies too, as we've talked about in our spending and budget constraints, what we're doing to try to address some of the overspending. So just stop me as you have questions. So in alphabetical order, we'll start with adult protective services. So adult protection is, you've heard me say for the last many years, this is one of the areas I worry about the most. for a couple of reasons. One, the workload continues to increase with our population that ages, and also just the level of need that we continue to see from older adults and their family members and caregivers in our community, while also there is really no strategy. And I have shared that with our State Department, but there really is no strategy to think about what is the funding that this program needs to do it well and how we start to piece together a multi-year strategy to address that. So this does not look different than where we are at this point every year. But one of the other reasons that I say this is one that worries me the most is that there is no backstop. This goes straight to our fund balance when we are overspent. So the other programs help to close each other out in different ways. Adult protection goes straight to fund balance or county-only dollars. If we are not closed out, which we are not, we had just shy of 400,000 that was not closed out at the end of the last state fiscal year that we have to cover with 100% county funding. And so this, I believe, is one of the strongest unfunded mandates counties have. And so there's a lot of conversations amongst counties and starting those conversations with your commissioners' associations as we think about our budget priorities. This is at the top for that reason. So again, looks very similar to what we see in years past, but significantly overspent because there's very little flexibility.
I might ask a clarification on that. This is something I've been passionate about for a while. And we know that population is going to increase the percentage-wise in our county, but you say there's no backstops. So can you clarify that for me and also for the public? We have a freeze on CCAPs. We can't take more, but what do you mean by that? We have to just serve anyone that comes to us and there's no limit? Or can you expand on that? Because I'm trying to understand if all of a sudden there's a big balloon of expenditures and we have to figure that out. I mean, I think it's important to maybe have us have that in the back of our mind that, there might be something coming that we can't have. It sounds like there's no control and maybe we can't really even plan for, so.
Very good question. So there are a couple of pieces that I want to clarify. This is a public safety. I mean, this is the same program as child protection. When there is an at-risk adult who is being exploited or abused by somebody else, or the majority of ours are actually self-neglect, where they're not able to take care of themselves, and it is creating a life and death safety issue today. Law is very clear, we have to respond. So that report comes in and we respond accordingly. We do an assessment to determine what is the safety concern, what's contributing to the safety concern, and then what do we do about it. So there is no way for us to turn that off or close the front door, nor would we want to. But if they meet the criteria for the safety concern, if they meet the criteria that we suspect that abuse or neglect is happening, we have to respond. So that's the first piece. The second piece is fiscally then, there is no other funding stream that covers our overspending before it becomes 100% of the county's responsibility. So I'll give you a good example in child welfare. We can determine if we want to use temporary assistance for needy families reserves to help cover the overspending in child welfare before then the county has to cover it entirely on our own. There is no other funding stream that steps in to help with the overspending here. The underspending of other counties helps to close us out. But like I shared last year, we were still $400,000 overspent in this program that the county has to cover 100% of that. So there are not multiple steps with other funding streams that help to offset. So we are having a lot of conversations about the service delivery, and when we do respond, are there requirements that the state has added on that are costing us administratively that don't provide the benefit? And how do we start to prioritize the administrative work so that we can focus on the service to the individual? Looking at what's required at the state level, and is that required at the federal level? And if it's not, should we continue doing it? Or are there efficiencies within the program that we can help to reduce the spending a little bit? But this program is far beyond that. When we're talking about being almost 65% spent at the half-year mark, we're already 15% overspent on our allocation. And so short of there being a strategy to figure out more funding for this program, we're struggling to figure out then what can counties have as a strategy to start to move the needle with the State Department to focus on this more.
Thanks for expanding on that, and confirming my understanding. Yeah, well, nor do we want to, but it seems like this is another area to maybe look at how we have other, but there is no other resources, but how can we have some kind of other funding federally or somewhere to come and kind of, I don't know, backfill or just help support that? Because I don't know if the Older Americans Act needs some more attention to that, and I don't know where we advocate for that. So I certainly welcome any out-of-the-box thinking, because I think this is, especially with the conditions we have right now, which I'm starting to call the Hunger Games, I think a lot of folks are going to find themselves in a lot more changing conditions that may not be of benefit to our most vulnerable. So it's something that also I've been thinking a lot about. Commissioner Stevens, Commissioner Kafalis, do you have any questions on that? Okay. Commissioner Kafalis?
Thank you. I'm just wondering, you had alluded that there's no discussion or strategy for addressing some of these issues, but is none of this addressed, for example, in the recent, I think the state just put out a multi-sector strategic plan on aging, and they're not looking at the changing demographic and what the implications are for public safety and things. Is it covered in, you know what I'm talking about? You guys,
Yes.
sure, Commissioner does.
So this is an area of focus on this population from the governor's office. There is a programmatic strategy. How they're going to fund that, there's really no conversations happening about what that looks like. So, and we've said that to the State Department of Human Services within the programs that they oversee. Every single year for the last several years, it's do more with the same funding. And we're running out of, I think, the time where we can continue to do that.
Thank you. Thank you.
Thank you. Let's proceed.
Okay, we are going to move on to child welfare. So this, again, has multiple underlying funding streams, with the total funding being just shy of 28 million when you roll them all together. So our THAD has been working very hard on this, as we've continued the conversations over the last couple of years to determine that we cannot continue to overspend to the level that we were. Yes, there is always the strategy to overspend just enough so that in the closeout process, counties that are underspent, their funding will be transferred to us. But last year, there were 3 counties that were not closed out, which is the first time in a long time that that's been the case. Which is our indication that we can't continue to overspend and expect to be closed out. So I've asked that to just share with you all what those strategies are. This is very close to what I would say is that comfortable spot of how much we can overspend, and constantly watching the relation of these underlying funding streams and how they interact with each other. We make decisions each month as we watch the spending, and as some of what we might pay for out of our core services can also be paid for out of the block allocation. So we have that conversation throughout the year. So I'll have Thad just share with you what some of those strategies are that we're still monitoring to come closer to our allocation.
Thanks, yeah. Again, Thad Paul, Division Manager, Child, Youth, and Family. What I might highlight is Heather's accurate, there were 3 counties that were not covered at closeout last year. We were the very last county to be covered at closeout, so we were on the cusp of not actually being covered last year as well. What I might highlight is, yes, it looks like, we're on target in most of these to be over budget, over allocation, I guess is what I would say, for this year, but that is a pretty substantial drop or reduction in our target. So last year, we ended the year about 3 million with the big 3 funding sources kind of rolled together. So core services, the block, and the workload money. We ended the year last year about 3 million over, and then we ended up getting that closed out. Right now, our projection is about 1.5. So in essence, we've reduced our spending by about 50% compared to where we were in that overage last year. I'll give a little high level. Some of that spending reduction, majority of that spending reduction is coming from staffing reduction. I do a every 2-week check on my caseloads to make sure that I'm not pushing the envelope too far that puts kids and families at risk, because of too many cases creates unsafe situations from a worker engagement perspective. So, but we've reduced about 25 positions since the beginning of 25 that we no longer have in child welfare and CYF. And that's at all tiers, that's administrators. So we all celebrated Angie's retirement last, and we're not filling that position as an example. So it's 3 different supervisory positions, an administrative position, caseworker positions across all teams. So intake specialists on the hub. So it is all areas of personnel are being impacted. That is very much driven by the budget, but we are paying attention to the balance of caseload and workload. And our workload, if you look at the most recent thank you, I was like, what's the word of it? Department activity report, we have about a 4% reduction of the number of kids open in a case this year as compared to last year at the same quarter time frame. But over the last 2 years, we've had a pretty consistent reduction in the number of kids that we're opening in ongoing cases. We do watch our outcomes to make sure that we're not closing too fast and those are coming back in, and that all seems pretty static. So I don't see any safety risk or concern based on our practice now. And there may be a time that we have to start ramping back up staffing just because the workload requires us to do so, because safety is the priority. We are also exploring all non-mandatory costs that might be associated with the work we do. So obviously staffing, out-of-home cost, out-of-home daily rates for foster care and kinship care is required, but we also do a lot of support to keep kids in the home, which sometimes looks like rental assistance. Maybe it's paying a car bill so that they can make it for the next month. So some of those are really tightening down and being scrutinized on a pretty significant level across the division. Open it up. Any questions that you might, real quick, statewide projections right now of the 3 funding sources for this current fiscal year project to be about 27 million overspent. So there will still be some closeout at the state end, which, so we anticipate being pretty close to fully covered by this year, but a lot of what ifs with all the other county spending in that space.
Any questions, colleagues? I just wanted to maybe ask you to clarify that again. You said 25 positions. That's significant, but you said you feel like there's no, you're meeting all of the needs and feel comfortable with that, but it might need to ramp up. Did I understand that correctly?
Yeah, so going back to 25, beginning of 25 is 25 positions less. We have not, it's been through attrition, not laying
Okay.
folks off. So let me maybe clarify that piece. And we're, as to Heather's point, we're about as far as we can go. We're as close as we can get. I don't feel comfortable going any farther from a personnel perspective at this point.
Yeah, and was my concern. With the changes and the uncertainty and the pressure I think we're all feeling from the state and federal government, I worry about everyone, I worry about all of us, but I want you all to take care of each other, and if you're right there, I hope that, you all have some dashboard that has some warning lights to make sure that we know when you guys might need support. So I just wanted to kind of clarify that, because that just made me kind of go, ooh, gives me a little pause, or just want to make sure that you confirm that's where you guys feel, you feel comfortable where you're at right now.
A big piece of that is our caseloads have reduced, so that's why we feel that would not be the rate where we should have been 2 years ago, because our caseloads were very different. So it is the balance, and people are working hard. There's no doubt.
Yeah.
I will also add, we have had a lot of conversations internally about what our caseload standards are. Thad and I have had some tough conversations, as he advocates for his staff, as I expect him to, right? That the caseload should be this, and we have had to bump them up a little bit. So finding that balance too of what types of cases are we talking about? You know, if the family is court involved, there's a whole other workload that comes with that. But we have had to increase the caseload standards. So staff might be carrying more cases than they were previously. And so we're constantly watching that too. As Thad said, he's looking at the caseloads and how they're shifting out across the staff. But we are increasing the caseloads in some pockets, but again, making sure that, one, there is no impact to child safety. So we look at not only the caseload, but the number of kids that they're serving, to be able to balance the number of children. So they may have fewer cases, but that's because they might have larger families that they're serving. And there are, I think, staff who would disagree with I will own that decision. That was my decision, right? To have to put that piece in place. And so we are monitoring those caseloads and the work that's also coming in to make sure that we're not also negatively impacting the staff. As Thad said, they are working really hard and have really complex cases. And we also have to find the sweet spot of living within our budget too.
Thank you for that, and I hate to draw attention to that, but I think it is important to address that, because there is a sweet spot, but also maybe a tipping point to stay away from, just my opinion. I worry about all local governments, if we're everyone across the state getting close to tipping points, so thank you for that. Thanks for letting me kind of address that, thank you.
Okay, we are going to move on to Child Care Assistance Program. So as Vanessa said, February 1st was 2 years on a freeze, and we are seeing a significant reduction in expenditures. And I have started the conversation with the State Department about whether it is time for us to explore a wait list. So we are having that conversation because we anticipate, so we are already about 8% under where we would expect to see ourselves if we were right on target with budget. And if that plays out into the remaining 6 months of the state fiscal year, we could be as much as 15 or 16% underspent. While also we have been watching the expenditures very closely, because as you'll recall, there was another provider rate increase that went into effect October 1st of 2025. And it is not until January when we really start to see what is the actual expense for us, just based on the reporting from the state, but also the seasonality of when kids are in school and need childcare. So we've been watching that very closely too, because that is an increase in expenditures that doesn't come with additional funding. So we will keep you updated and may request to come back before you again if we anticipate being able to move to a wait list before we come back for our next Board of Social Services meeting. There is not a lot of clarity from the State Department to counties on how you do that. So that's what our conversations have been. How do we transition from a freeze to a wait list? What does that mean? What will that cost us? And how do we process then that work differently? So those are the logistical conversations we're having with them to then determine if we can make that decision. We don't want to switch to a wait list and then have to go quickly back to a freeze. That creates too much disruption for a community that's already challenged with the freeze to begin with. So more to come on that, but we are at the point where we can start exploring that and having that conversation.
Okay, Commissioner Foss, you have a question?
Well, just mindful of the time, and we still have quite a bit to go through. If time allows, whatever questions that may remain, I'll offer them at the end, if
Okay.
time allows.
Heather, I was going to actually ask you for a time check just because I was looking, and so we have a few more pages. So how do you feel about?
I think we're okay.
Okay, great, thanks.
I think Commissioner Stevens, did you have a?
Yeah, I'll just ask a brief question. So is the freeze still, we know we received a freeze from the federal government and that there was a restraining order, but those dollars are still coming in, correct?
Yes.
Okay. Do we have any news about what that, will there be a decision, a judicial decision that will give us some certainty around that?
So there has been an extension of the restraining order now twice, maybe even 3 times. And the federal judge has extended the restraining order until they issue a written final decision. And the State Department has communicated to us that they have the funding on hand to be able to sustain the program through May 31st. So that gives plenty of time for the final decision to come in. And they have been able to receive the funding and be reimbursed from the federal government during the restraining order. So we should hear, I think it's the end of February by the date that the federal judge has committed to having the decision.
Thank you. And then, I think I had another question, but it's escaping me now, so I might ask it later. Thank you.
Thank you, Commissioner Stevens. Go ahead, Heather, proceed. Thank you.
So the next program is Colorado Works. So we are slightly overspent, and that is intentionally so this year. So we've had a lot of conversations about the TANF, Temporary Assistance for Needy Families, Colorado Works program and budget. And almost 2 years ago now, we had to stop all discretionary spending, what we call supportive services. And we have intentionally budgeted some money towards supportive services this year for 2 reasons. One, as families are adjusting to new work requirements at the federal level and the shifts and policy changes in other programs, recognizing that many of these families are enrolled in other programs, they are needing to really meet those work requirements, and a lot of that comes into play with supportive services. If they don't have transportation to get to work, we can't expect them to work, those types of things. Or if they're not able to get a CDL, driving certificate to be able to get to work, we're paying for some of that out of supportive services. So just trying to intentionally stabilize those families as they're experiencing a disruption from other programs is one piece. The other piece, though, there is a lot of conversation, and there is the recommendation from the State Department to the Joint Budget Committee that they reduce the allowed TANF reserves amount in counties from 40% of our annual allocation down to 20%. So we are intentionally spending this. If that comes to fruition, we will know on February 24th. The Joint Budget Committee will decide on those TANF recommendations. I am actually supportive of the reduction state, as I see sort of where different counties are sitting. 40% in your reserves is a lot, and a lot of counties are still sitting at that max. We are not. But if the change next year is to cap our reserves at 20%, I would rather see us spend the money here than have the state take it and do whatever they will do with it in the reserves. So we're constantly watching that too and being very intentional to serve our community from that funding, with the very likelihood that the funding will be taken from us in the near future. So part of strategy, but also trying to stabilize the families receiving the services.
Commissioner Stevens.
Yeah, I remember my question from the last one, and it kind of goes towards this one. So there are recommendations to pause. So part of TANF, so folks know, is basic cash assistance. In fact, a large part, and for us, the only part for a while, although now it looks like we are budgeting some for others. But there's a COLA or a cost of living increase that goes with that, and there, because of, uncertainty about funding, we've talked about pausing, or suggested potentially pausing that cost of living. And I'm wondering kind of where that's at. And then the same thing with child care assistance program. Were the provider increases a federal or a state requirement? And if they were a state requirement, are we considering pausing any of those provider increases in that program?
So the basic cash assistance, there is the recommendation's been made, I think, now for 2 years from the Works Allocation Committee that you sit on. Thank you again. I know it's a lot of work. But the State Department also made that recommendation, and it's in the governor's proposed budget. So I anticipate that piece will move forward, whereas the other TANF recommendations in the governor's budget may or may not. But there's been a lot of conversations that we can't continue to increase the basic cash assistance as we are. So that is also going to be decided on February 24th. We've had a lot of conversations with Senator Kirkmeyer to be able to answer her questions about that, the impact, the benefits, so we'll know here very soon. The provider increases were a previous audit finding that the state received from the federal office that we were not compliant with how we pay providers. So we had to come into compliance. The State Department came up with the methodology of how to do that, which then spread the provider rates over 3 years. So this was the second of the third year. The State Department has gone back to the new federal administration to ask them to relook at whether we still have to do the third year. The second year did bring Colorado into compliance with how we pay providers, and so they're asking for more flexibility to potentially not do another increase this coming October, but we won't know for a little bit.
Thank you. I think that was a great question. Commissioner Stevens, proceed, Heather. Thank you.
Okay, Community Services Block Grant. This actually runs on a calendar year, so we are right where we anticipate being. Again, Community Services Block Grant, we actually strategically utilize very similar to TANF Supportive Services. It has the same intent from the funds, and so we use this intentionally to help provide a lot of those same services out to a lot of the same recipients. So a lot of direct resources provided for transportation, some housing stabilization, things like that. County administration, this is, as Vanessa said, how we pay for the eligibility work. And we are right on track with where we expect to be. There was a pretty significant infusion from healthcare policy and finance last year, which is why it looks like we are underspent, and a lack of infusion, if you will, from the Department of Human Services. But this is also the CDHS County Admin is also the line item that will now be supported in combination with the Healthy School Meals for All funding. So that will come into play and also help with the overspending here because this is the SNAP administration funding. So no surprises there. We watch this very closely and really try to monitor what the workload looks like. Employment First is the case management program, again, for the food assistance program, so functions very similar to Colorado Works, but for SNAP recipients. And we don't overspend this because then it requires the county to cover it 100%, but again, works in companion with Community Services Block Grant in a very similar way. So right on track with where we believe we should be. This also is on a federal fiscal year. So this just restarted in October, which is why we're 12% spent. but right where we should be. Office on Aging. So we are, again, this is, because there are multiple funding streams that come into this, it always looks a little wonky, but we are right where we should be, and constantly monitor how much we have going out to our contracted community partners versus how much we have for staffing. And there, we are really talking about additional grant opportunities here. So we have applied for a regional grant that will help what some of the team is already doing, going into nursing homes and helping provide options counseling is what we call it, about what are the options to get out of a nursing home and how would we then help that person access the services to be able to get out of the nursing home. So Healthcare Policy and Finance has offered some grant opportunities. We've secured a grant for Larimer County already. We received that, and that's part of our budget. But they are looking for interested parties to help serve Boulder and Weld residents that are in Larimer County facilities. And so we've said, yes, we would be happy to. And so that might open up some additional funding to, again, help support what we're already doing. The other piece that is also housed in here, we're applying for a grant from the Colorado Disability Opportunities Office to help us continue to navigate Social Security. So we have a staff member who helps individuals navigate the Social Security benefits, and we've applied for additional funding there to expand that even further. So looking at different opportunities here to increase the services where we can and go after additional resources. And also starting to look at how we might bill Medicaid. So that's the other piece. We are working on very similar to Community Justice Alternatives as they've become a Medicaid provider, looking at how we might do the same. And a lot of those services are happening within our Office on Aging as well. So bringing in some Medicaid revenue to help diversify the budget and expand services where we can.
I know we're kind of tight on time, but I just wanted to ask overall, this question comes from recently attending a new open house for behavioral health services that took over a nursing home facility that I guess closed down, but it's a lot of beds there, and now it's a behavioral health and long-term center. When you mentioned Greeley and Boulder bringing folks here, is that because there's less options for nursing long-term care in other areas or regionally? Or what are we looking at? Or is there, are we seeing a need there and folks who are needing services that are going where the beds are? And I'm just curious about that.
I think it's a mix, really, of a lot of different dynamics. I think a lot of times it is where their family support might live, so they might be moving closer to a family member. There is a lack of Medicaid-funded beds across the board, so they might have Medicaid as their insurance coverage, and so they're having to go where there is a Medicaid bed. I think there's a lot of different dynamics on why individuals might be crossing across regional boundaries or county boundaries, especially from our Boulder communities. A lot of them come into Larimer County for services or vice versa when we're talking about healthcare. So I think there's a lot of different reasons why there's crossover.
Thank you.
Any questions on the finance update? Otherwise, we'll wrap up with a district. I have it on the calendar till 3:30, but.
That's what it's on my calendar.
Okay. So a quick update. Again, there was a budget proposal submitted from Healthcare Policy and Finance to centralize some key services for counties, while also another initiative that the Department of Human Services is spearheading to district. We really think of them as a large proposal. They strategically broke it out across the two state departments based on the budget submittal and the legislative processes that they were working through, but it really impacts the programs all in the same for us. So one really important key piece, the Joint Budget Committee actually did not support the healthcare policy and financing budget request to centralize the services. And I think that's for a couple of different reasons. One, there has been a challenge for the State Department to actually show the savings. So they've submitted this proposal to centralize these services because they think over the long term it will actually create a savings, but they're requesting several $1 million to get it off the ground. So there's a disconnect there that I think has not been able to be articulated, even in our conversations with the State Department, but then as we've listened to the Joint Budget Committee, articulating what the long-term savings is and why that warrants a really significant infusion now. And there's a lot of conversations happening with CCI lobbying with alternative ideas of what can be centralized. Because we are not sure that the services they want to centralize are really the ones that should be centralized. And they will have a very direct impact on residents. But there are other things we would love for them to centralize that would create a lot of efficiencies for counties. So a lot of work happening behind the scenes to really figure out what should be centralized and how that happens. That then there also is a lot of conversations happening with CCI, with a small group of commissioners that Commissioner Stevens has been participating with, and the governor's office as they look at then the districting and what cost savings that might create for the state. And an alternative proposal has been put together from a small working group of human services directors. Hannah Ditzenberger on our team was instrumental in helping to support that team. We did not Larimer did not participate as a county in that small working group. But Hannah had spent countless hours helping to pull the proposal together and really help support that small working group. So that alternative document was finalized last week, and CCI is now thinking about the strategy of how to then propose these alternatives to districting. And that's really where it sits. While there is still a lot of work happening to draft legislation that will have to accompany that districting proposal. So it has come about in the budgeting conversations and the JBC's process, but it will require a very significant bill on its own to be able to make those changes. And so while there is still a lot of work happening, every Tuesday we have 2 and 3 hour meetings with the state departments to sort through what this might look like. There isn't a bill yet to react to, so that's why we haven't come before you to try to figure out a more formal stance to this, because we don't know. The devil's always in the details, right, of how the legislation is drafted. So when we have something to bring to you to react to in a more formal way, then we'll do that through the normal legislative process. But it will probably be the next 3 to 4 weeks before we actually see something. Because there's been a lot of adjustment, I think, in alternatives that counties have proposed just in conversation. There is a willingness to evaluate those alternatives that then I think delays what goes on paper in terms of the legislation.
I just wanted to add, I know Commissioner Stevens has been in those meetings and she's been very gracious to just allow me to sit and be quiet so I can listen because there's so much happening. I'm trying to just stay up to speed because it's been changing. And I just want to make a comment from in December, that first week when we all started learning about this change and we had those meetings and it seemed we heard there was non-negotiable things, but we were able to increase the timeline and we really, I want to commend everyone, including Commissioner Stevens, who's been at that table. Sometimes I feel like we need to call it something else, but just to keep pressing and trying to keep saying, work with us and help us. And all the things you just shared, and thanks to Hannah, especially just for helping another group. but get there. I think there's been a lot of time and effort put in just trying to bring some better solutions and to press that there is some things that maybe need to be addressed technology-wise and other things. And so I wanted to share with the public that I'm just really super proud of the efforts and our staff, because we've had a lot of staff presence and efforts there. And I know it's been some hard conversations. Some of the ones I've been in there were spicy. Maybe that, I don't know what a better word to use. But that's important. I mean, the pressure's there because it matters, right? If it didn't matter, we wouldn't feel the pressure. And so I had made a comment last night about that. I mean, the pressure's there because what we do matters and the work matters. And so that's why we're so invested. And I just wanted to commend you all for hanging in there. I know this is above and beyond what you're already doing and what you've talked about today, but I think tremendous progress and even innovation or even collaboration has happened that I really had doubts in the beginning. And I just wanted to all thank you and just commend you for hanging in there. We're all hanging in there. So, but I do think there is some glimmers of hope here. So I think, but the Joint Budget Committee is certainly something that I had not heard. And so I appreciate that update for sure. Thank you. Mr. Stevens.
Yeah, thank you, Madam Chair. Yeah, I mean, it's such a moving target here on this. So it's been, you know, I saw something that came out today that was, that I think that CCAT governance saw, you know, around what the Human Services Directors Group was looking at. So it looks like maybe some kind of centralization, but not maybe around the issues that were first proposed. So, which were like a call center and quality assurance, and then there was one more thing, which I can't remember.
Scanning documents.
Scanning documents.
And then
weird.
fraud.
Oh, the fraud. Okay,
Receiving
yes.
fraud reports, investigating and recouping the money.
Yeah. And so there might be some sort of centralization, but yet to be determined of what that was going to look like. And then you think that the districts will happen, but maybe not for a while, certainly, and you know, some of what I just briefly scanned what I received, but it looked like some of the district kind of were maybe a looser conglomeration of what they were doing than sort of this tight group that controlled everything. But there again, I suppose that could change as well.
So what I have heard, and I think it's similar to what's been talked about in the CCI meetings, is that from the state's perspective, districting is not negotiable.
Okay.
That there does need to be a different makeup because there is so much redundancy across, you know, the state trying to manage 62 different departments of human services is not efficient from their perspective, but also there's a lot of redundancy in 62 different counties doing similar work. So that's what I've heard, is that they do want a different makeup that reduces that. How that happens, though, I think is where there's still challenges. Yes, technology is absolutely crucial, but it's why I wanted to also highlight for you where we are doing it today, and we're making it work within the technology we have, and learning and still seeing the benefits. And we are a county that operates in meeting all of the requirements we have today. Yes, we have very constrained budgets, but we're not setting one requirement aside and not meeting it to prioritize it. You have to meet all of the requirements, and you may not do it the best, right? But we are, so that's also, there are requirements that some counties are not meeting. And that's a very different discussion that we're not participating in, because I agree, we have to meet all of the requirements. Quality assurance is not optional. In our approach, in how we administer the department, it's not optional, but it's also not optional for the state. And so when there are multiple counties, dozens of counties saying we're not doing quality assurance, that's a problem when we're now talking about millions of dollars in fiscal sanctions around error rates, right? And so you can't just set one requirement aside because you don't have the budget. You have to figure out how to meet at least a little bit of each requirement and adjust priorities as you can. So there are some challenges that the state is trying to alleviate, that don't impact us. And so we are being a little bit more quiet in those conversations. So how it will happen in the districts, I think, is still yet to be determined. Yes, technology will impact all of it, but change has to happen.
Right, and, so the public understands this, what feels a bit like insider baseball is that we have county-delivered human services in Colorado, and not all states have that, and while I think there was always the possibility to penalize people who had error rates, both in Medicaid and SNAP benefits, the current administration has chosen to follow through with those penalties, and the penalties are in the hundreds of millions of dollars. So with a state that has not a budget to cover some of those penalties, we have to look at different ways to deliver services. And ultimately, I mean, if there are communities that don't have that quality assurance piece, that maybe can't deliver the services in the way they were meant to be delivered, then looking at the system as a whole and trying to make those fixes is really important. And so, there are a lot of meetings about this, as Commissioner Shattuck McNally said, and, kind of to be continued of what comes out in the wash, but certainly non-action isn't an option at this point. Like, we have to do something to fix some of these issues. But thank you, Heather, for staying engaged, and I feel like I might text you a million times in a meeting to ask questions, and I really appreciate all the support from everyone in trying to figure this out, and I ultimately we will, but there'll be some growing pains while we do, so thank you.
Thank you.
Commissioner Gonzalez?
Thank you. I'll give it a try. Just a few questions. One is regarding the legislation that we will likely see perhaps within a month. Is it your understanding that would be a JBC bill or not necessarily?
I do not believe it'll be a JBC bill based on who we're hearing might sponsor it. But the JBC will be discussing this on February 24th in relation to the shared services component. But they want to also district the TANF program. And so they're going to leverage the budget decisions related to TANF to also sort of pull this into their discussions on February 24th.
Thank you. May I continue with a few more questions?
Certainly.
Thank you. Is it accurate to say that the governor is at least a bit more receptive to some of these alternative proposals that the small working group folks have put together? And associated with that question, Heather, understanding that the matter of districting is, quote, non-negotiable, although I understood that the way the proposed districts were presented initially, that map, that could change. So is the governor a little bit coming on board? Is there good conversation, understanding non-negotiables, but in the end, 2 to 3 years from now, when there's some kind of hybrid model, what was presented might be different, if that makes sense, ma'am.
Yes. So I would say that the governor's office is driving this a bit more in recent weeks than they were initially. And that was because of very loud feedback that it was not appropriate for the state departments to be working on this for upwards of 18 months before counties ever knew about it. And so much rework has had to happen because what was presented is not actually a solution that counties feel is feasible. And some of it, I mean, if we centralize calls, for example, that will have a direct impact on Larimer County residents who are trying to reach us to find out about their Medicaid case. It will be centralized to whatever county administers that call center in hopes that they can answer the question, and if not, then they kick it back to Larimer. So the direct impact to residents that are trying to access these programs, I think, was underestimated in some of the ideas that came about. I understand how the governor's budget process is very closed door and counties are not allowed to have insight into that, and how that caused some of what we're talking about, but the level of detail that was developed before counties were brought to the table was unfortunate.
appreciation for Vanessa and everyone. I think you've been pretty involved.
Commissioner, can you turn your mic on?
If you insist. Thank you, Justine. Yeah, just thank you to Vanessa and certainly others who have, of course, you, Heather, been very engaged in the small working groups. I'm curious, I just have two more questions. One of the bullet points indicates that we are reaching out to the state of Wisconsin. What are we learning about how they're having some success in addressing error rates and, not having duplication and trying to come up with a efficient and effective system?
So Hannah has been taking the lead on that research quite a bit and has secured we've had multiple calls with Wisconsin, but this one coming up is going to really focus on their quality assurance process because they had really low error rates long before the federal changes came about, but they also had really low error rates before they decided to district themselves. So they have a similar structure, similar structure to what the state's proposing, which is why we're talking with Wisconsin. Still considered county administered, state supervised, even within that district structure. And they have implemented technology that actually screens applications before it gets submitted. So similar to when you apply for a student loan or when you apply for a mortgage loan, you can't click submit until you've hit those required fields.
Interesting.
A food assistance application doesn't have that same technology, so people can submit it with really significant pieces missing. Once it gets submitted, the clock starts. And so thinking about the technology that could help us screen some of that and help communicate back to the person applying that they're missing pieces. But they also have a really great relational structure between their districts and counties and the state where they're looking at this much more regularly. And we don't have that process in place. So we're trying to learn what they're doing and see what we can then replicate. And the Joint Budget Committee is aware of the technology Wisconsin is using. And I know CCI has been having conversations to see how we might be able to get that technology funded sooner than some of these larger technology enhancements.
Not wishing to be too cynical, the matter of not submitting anything until there's a way to make sure that all the information is, that seems like even something I could come up with. So I'm glad we're on that track. But my last question is, and I appreciate the time, and that is going back to a little bit to the child welfare piece. And I appreciate your updating us on the federal, the letters that we received from on January 6th, I think it was, regarding the freezes on the CCAP, TANF, and I believe also the Social Services Block Grant, which I think a small percentage of our funding comes from that. So I'm wondering if what you updated us on extending the temporary restraining applies to those, and what's the situation with that funding that we get from SSBG, to help us make sure the kids are safe?
The legal process applies to all of the programs together. So it does include Social Services Block Grant helps fund a portion of child welfare and adult protection. It's about 10%, I think, of adult protection and 6% of child welfare. So the legal action is a case that's been filed to stop the freezing of all of it together.
And the state has said that funding is in place through May. Did I hear that correctly?
For child care assistance program, but the other programs, the SSBG and the TANF function a little bit differently because they are entitlements. So the way that we get reimbursed looks a little different and is not as dire.
Okay.
Whereas CCAP has an end date. When that money's gone, and the program has to turn off at the state level. The other two funding streams function almost on a line of credit. So a little bit different, but the legal action
Great.
is helping all of it.
Thank you. I'll leave it at that. Thank you, Madam Chair.
Thank you. I saw the next slide was kind of a wrap-up. I just want to make sure, did you have anything else you wanted to share on that?
I think that's it. So we will certainly keep you updated as things progress with the current legislative session and come back before you if we need to when we have something more formal to actually review and provide to you.
Lorinda, I want to give you an opportunity to speak. I I know you've been taking this all in and watching over there, you've been taking a lot of notes as well.
What I'll say is Heather's a really good communicator, and so she's good at keeping you all updated in various ways. She's great at bringing things to our attention when they arise to that level. There's a lot of uncertainty. Most of it is around how much money and what are the rules of the game anymore. And so I appreciate the work Hannah is doing, that those detailed reports are really very helpful. And your update to flag when we should be paying attention and what is going on, when are decision points, has been really good. I hope the public hears your care and concern for serving the public. I think we're talking a lot about administration and nuts and bolts and dollars are coming in and going out. But really, I know your team focuses on the people we are helping in the community. And so I don't want folks to hear this and think it's very businesslike. It really is about serving the people the best way you can. And I hope that that comes through to them. I know it does every day they walk into your office because we get those comments from folks and they're very grateful. But I know you're concerned about it as well. And so I guess keep telling us what we need to do and how we can adjust and what the decision points look like going forward so that you can get the direction you need to move quickly.
Thank you.
I couldn't say that even better than you did. That just exactly what I was thinking was really at the heart of this, is we're just trying to serve the folks in our community the best way we can and also take care of our staff. Because it is important to have the right people in the right places and provide these services. And I believe that's the secret sauce of Larimer County is our amazing staff. And so I couldn't agree with you more. And the reason we're having this discussion is because we're trying to support all of that. So I thank you for your comments. Colleagues, are there any other closing comments you'd like to make, Commissioner Stevens?
Sure, thank you for grounding us in that, Lorinda, because I think that's really important. I mean, these are services that affect the most vulnerable people in our community, and so it's really important to figure out how to keep these services, working for the people they're meant to help, and to really try to make them more efficient as we, deal with dwindling dollars. And so it does come off sometimes being very businesslike, but people are at the core of what the work that you all do and that we all do, honestly. And so it's just great to have, as Commissioner Shattuck McNally said, our staff is really important in that work. And so thanks to all of you really for a great job that you do and for making sure that we are taking care of people in need.
Well, I was going to tease you that you started off with.
Can you turn your mic on, Commissioner?
Oh, thank you. I was going to tease you all that you started off with these two good news items, that maybe that was to help out with the rest of the things. But I mean, really, I think the message out of the rest is we're hanging in there and trying to be at the table to wrestle this for the benefit of our residents in our county. So I just appreciate you all so much, and thank you for the work you do, and thanks to all Lorinda and Lori and all the work you do to support them as well, because it takes a really big team to do this. So at 3:23 this afternoon, we are adjourned. Please take care and have a great day.
Thank you.